Mayor Robert Garcia, and we are doing our update here that we do to the community to Long Beach. These updates happen on Mondays, on Wednesdays, and on Fridays at 3 p.m. Today, we're joined by Dr. Davis, who is our health officer here, of course, in the city of Long Beach, and really runs all of our medical and health operations here in the city of Long Beach. We're also joined with Alice, who you've seen before, who's going to be doing our translation in Spanish at the end of today's broadcast. She'll summarize that. Alice va a decir todo en español en el final de hoy día también. So thank you, Alice. And behind us is Paola, and Paola does a lot of our interpreting, and just very grateful for her as well. I have a lot of news to report and information to report to everyone today. I want to start with some good news and some news that I think is very positive as it relates to our community. Just today, Virgin Orbit, who is a company that's based here in Long Beach, as people are aware, Virgin Orbit is one of three rocket and space companies that we have here in the city. This has been an economy that's been growing in the city in the last couple of years. And Virgin Orbit today announced that they are actually transitioning into building ventilators and a ventilator system now that we are in this COVID-19 crisis. And so when this crisis happened, they began having communications, in particular with the governor's office, Governor Gavin Newsom, who has been incredibly supportive of us here in Long Beach on a variety of issues. And the governor and the governor's team connected Virgin Orbit, which of course is a Long Beach-based company that's based right here, with the Bridge Ventilator Consortium, which is a group of doctors and scientists here out of UC Irvine, as well out of Texas. And that group came together to design what is an all-new ventilator that can be used on the front lines by our medical professionals here, not just in Long Beach, but across the country and really the state, which is where the focus of Governor Newsom is. We do know that this ventilator is now pending approval from the FDA, but we've been communicating, of course, with Virgin Orbit, and they've just told us as recently as today that this is ready to start the construction and the production in just a couple weeks here in April, which we know we're going to have this huge surge possibly, and so they are ready to go. They've designed and built some of them already, and so you should be proud that your city and a Long Beach-based company here right in Long Beach is going to be transitioning to building these ventilator units really to help people across the country. And for those of us that know someone that has challenges, is asthmatic, has issues breathing already, this is a huge relief. I'm one of those. My family, my mom has challenges in this area. I know a lot of families do as well, and so it's a sigh of relief for a lot of people that this help is on its way. And so just want to thank the entire team at Virgin Orbit. These are some of the best engineers, many of whom and their leadership team live here in Long Beach. These are former students, many of whom went to Cal State Long Beach in the engineering school, and we want to thank them tonight and today for their support and this amazing work. I also want to share that we have, I have some more information as it relates to testing in Long Beach and our counts. I thought it was important today to give everyone a little bit more of an update on some of the details around how many tests are being performed, what our capacity is, and what can we expect in the future. First to report is we have a total now of 115 COVID-19 positive cases. That is a number that continues to increase. And you know, if you've been following the numbers, that they exponentially grow day to day. Just earlier today, we were at 106, and now we're at 115. It seems like it was just days ago that we were reporting that we were at 25 and at 40, and so this number will continue to increase. And please know that because the number is 115, that's not necessarily reflective of the folks that have COVID-19. We can presume there are many more across the city of Long Beach, and so we just need to be very aware of that number. But I want to share how we are doing the testing and what the actual process is. It's important to note that all municipalities, cities, counties are all partnering in partnership. And so the city of Long Beach has its own health department. That health department partners with LA County Health. LA County Health is partnering with the state, and all of us partner with our hospitals and medical providers. So it is a unified system of testing. Within the city of Long Beach, we estimate that there's probably been, if you look back at when the first outbreak began happening and we tested our very first case, the city of Long Beach and our partners in both the public and the private side, because much of this testing is being done in private labs, we have probably performed about 1,300 tests. Of those 1,300 tests, and this is approximate right now, we're getting some finalized numbers, about 1,000 of those tests have been through our private lab partners in the city. And these are laboratories that are getting the tests directly from doctors, directly from hospitals, and these tests are then being sent out to be performed for cases here in Long Beach. And of those 1,300, about 300 of those have been performed directly by the Long Beach Health Department. The Long Beach Health Department is averaging right now about 25 to 30 tests just within the health department. That is separate of the many more tests that are being done through the private labs and that are being done directly through a doctor's recommendation or a hospital recommendation to private labs. And so that gives you an idea, since the 2 weeks that we have been discussing the main COVID-19 outbreak, there has been about 1,300 tests in Long Beach, and we're going to share even more data and more information in the next few days, but that gives you a broader picture. We know, obviously, that this is we want to do a lot more testing, and I want to share what we have coming in the future. We do have right now today, the City of Long Beach Health Department has about 500 full testing kits available for those that really need the test. And we are following the federal CDC guidelines on who should get a test and who is prioritized and triaged to get those tests, because we know there's a national shortage. In addition to those 500 tests that we have currently, we have an additional approximately 1,000 other tests that are still waiting for a critical piece of that test to make them active. A test kit contains many pieces, and so while we have 500 full test kits, we still have and are waiting for a piece to complete the additional 1,000 testing units that we have in the health department. And we are receiving, of course, different pieces of this every day. Our orders are coming in, but people need to know that there is a national backlog of tests, of testing kits. We are getting and trying to receive as many tests as possible to do as many tests as possible. We also should note there's been conversation across the country about drive-through testing and when are we going to see drive-through testing. And so right now, the City of Long Beach has a limited drive-through capacity that is happening right now at the Long Beach Health Department. But this is for the limited tests that we are doing daily. Those 25 to 30 tests that we are doing are by appointment only, and they're being referred to the health department through our hospitals and through our medical partners directly. And so we do have a drive-up system at the Long Beach Health Department, but you must have an appointment and it must be recommended by a doctor or a hospital. Our goal is over the days ahead and week ahead, we are partnering and talking with our partners across the county to open up additional drive-up testing type sites, additional drive-through type testing sites that would be here in the city of Long Beach as well. They are starting to pop up across the country, and it's really a question of capacity, where is the most need across the country, and where the tests are being sent. And so all of that is part of this discussion, but please know that we are doing everything we can to get more tests. We are testing individuals. We have performed over 1,300 tests, and we are performing critically about 30 a day to those that need it the most. And that number in our testing capacity is going to increase over time. And so our hope is that these next few days and week ahead, as we begin this critical month of April, that testing capacity will increase. And we're going to have more information about testing in the next few days as well. As it relates to testing and hospital and medical capacity, I want to share that earlier today, our fire chief, Javier Espino, has also been named to head all the coordination across our hospitals. And so our fire chief is now working directly with our hospital CEOs, who we've all been communicating with, to ensure that they have the supplies and what they need from the city to have a more centralized communication system. And so we're excited that he is doing some additional work to support our hospitals as well. And also please know that the city has right now and is putting together an extensive plan for overflow capacity for our hospital systems. Our hospitals right now today are serving not just COVID-19 patients, but of course other patients that have critical illnesses and that need support. Every single one of our hospitals and partners in the city, whether it's Memorial, St. Mary's, College Hospital, the VA, who's an important part of our system, and the soon-to-be open community hospital, which is very close to opening its doors and bringing in patients, are all working with us to expand their capacity for overflow. And so the city has identified multiple sites across the city, of which we will be sharing in the next few days, where we're going to be building that overflow capacity for beds. It is our goal that we have enough beds in Long Beach to treat the surge that we expect to happen in the weeks ahead. And so we want to make sure that we have enough hospital beds, enough quarantine sites, enough locations for people to recover and rest as we move forward in the weeks ahead. That right now is the top priority. So as far as all the things happening in the city, we're most focused on making sure that the hospitals have everything they need to do their job and so that they can successfully function as a city. A couple more items to announce. We're going to have in just a day or two, the city has worked with some partners to build a new system called Work Long Beach, which is going to connect people who need work with other individuals and families that are looking for childcare. We've already piloted this program for Memorial Hospital for some of their medical staff, and we're going to be putting this out across the city. And so we'll be announcing this with the web portal in the next few days called Work Long Beach. And if you need childcare or if you need work and are able to do childcare, it's going through a system that's being verified, that will be up in a few days. So we look forward to helping that way as well. Also want to announce that over the weekend, we also opened up our third shelter for people experiencing homelessness. We know that we have a huge population that's very vulnerable. Now we have 3 shelters across the city for people experiencing homelessness. That is the Hayes location just west of downtown in West Long Beach. Then we have the North Library in North Long Beach, which is the old North Library, has been converted, which was sitting empty, has been converted now to a shelter, and we're expanding the shelter capacity at that site. And now we have Silverado Park in West Long Beach, when that facility has also now been converted to a shelter for people experiencing homelessness. And we have a 4th location that we are now working to make sure that we also put in place, which we'll be able to announce in the next few days. And these locations are being, we're ensuring that these locations are safe, that there is appropriate distancing for the folks that are there, as well as the employees, people that are working. And we want to thank the neighborhoods and the community for being supportive of this work. And so that is on its way as well, and we're very grateful for that. Let me just also mention some additional information as it relates to closures. You probably been reading a lot of information about what is closed and what is not closed. So I just want to be very clear once again that as of today, until May the 1st, all facilities as they relate to our beaches, the beach bike path, the beach walking path, Parking lots at the beach and in our parks, unless you have a permit. The pier, all park facilities, sports courts across the city, playgrounds are all closed. They're not to be used, including skate parks and other facilities. They are all closed until May 1st or until we announce some different date. That is really important for people to respect because we are trying to physical distance folks and stop the spread of COVID-19 and flatten the curve. In addition to that, we still know that small businesses like bars, like full-service restaurants, even though you can still order takeout, of course, and to go, and all non-essential businesses are still closed. Those dates are looking at possibly shifting even beyond the current mid-April date, and we'll discuss that in the days ahead. But you've probably heard from the governor and others about some of those dates, as well as the CDC. And so we need folks to be compliant, and remember that you need to stay home. If you're not part of the essential business workforce as outlined by the city and the governor, you need to stay home. You can still go out for a walk in your neighborhood if you need to, but use distancing. You're even allowed to walk through a park, but not gather, and you cannot do it in groups. So please use physical distancing and please try to take care of each other because our medical providers and our hospitals are really counting on us. And then the last thing I'll mention before I turn this over to Dr. Davis is as a reminder, we are not having any tickets for parking as it relates to street sweeping for the entire month of April until May 1st. And if you need a parking pass so that you can move your car, because we're still going to try to street sweep where we can, if you want a parking pass, a free parking pass in lots across the city, you can now go to longbeach.gov and look on that site, and there's a link to where you can get these parking passes. So please get a parking pass if you need one. We have open lots. And on street sweeping days, if you can move your car, move it, because we'll try to sweep, but we're not going to ticket you. But ticketing will still be in place for red curbs, which are emergency curbs, and blue curbs as well, because those curbs are critical for fire safety and for paramedic safety. So please respect those boundaries. And with that, there's obviously a lot going on. I want to turn this over to Dr. Davis to just give a little bit more update on some of the medical issues, and then we're going to do a summary as well in Spanish. Dr. Davis.
Thank you, Mayor. As the Mayor shared, as of today, we have 115 individuals who have tested positive for COVID-19 in the city of Long Beach. This represents a greater than 50% increase in the number of cases since Friday. And this increase is also being seen throughout Southern California. The next few weeks will be crucial. We've seen large increases in cases in New York City, New Orleans, and other locations. We've seen their healthcare systems be overwhelmed. Unlike the flu, there's no vaccine or medication to treat COVID-19. And because it's new, everyone is susceptible. This virus loves to spread from person to person. It's spreading in our community right now. So how do we stop it or slow it down with everybody being susceptible and no vaccine or medications available at this time? The way we do that is by having fewer people in contact with each other. So the fewer people that get within 6 feet of each other, the fewer people can get infected, the fewer people get hospitalized, and the fewer people that get really sick. So physically distancing yourself is the most important thing you can do right now to slow the virus down. And I just want to take a minute to look at the term social distancing, which is what we've been using up until now, and which some people feel kind of connotes a picture of solitude. Instead, it's easier to think of social distancing really as physical distancing. That's really what the point is. Social or physical distancing simply means increasing the amount of space between individuals in order to reduce the spread of COVID-19 in our community. So we want you to be socially connected via phone and video and other ways, but we want you to be physically apart. And the larger physical distance that we have between individuals makes it more difficult for the virus to spread person to person. And this really is keeping with the spirit of the Safer at Home policy. In the meantime, we do want to clarify that you can and should still get outside and walk, run, or bike in your neighborhood, but please only do so if you're able to keep at least a 6-foot distance from others. We have to keep emphasizing doing those top 5 things to stop the coronavirus. So number 1, wash your hands or use hand sanitizer. Wash your hands for 20 seconds. Number 2, don't touch your face. Number 3, cover your coughs and sneezes. Use your elbow or a tissue. Number 4, physically distance yourself. This only go out the house for essential reasons, whether it's to get food or if you have an essential function and you need to work. And stay home if you're sick. So even if you do have an essential function as a job, if you're sick, you need to stay home. We are continuing to see a national and global shortage of testing supplies for COVID-19. To align with national guidelines, our public health lab is prioritizing tests for those who are exhibiting symptoms, are at a high risk for developing a serious illness, or work in high-risk occupations. The process for getting tested remains the same. If you're experiencing symptoms, call your healthcare provider. They will direct you on the next steps. We love to be able to test every person in Long Beach who wants to be tested. Unfortunately, our testing supply capacity right now does not allow us to do that. Please continue to stay informed and up to date on COVID-19 by visiting www.longbeach.gov/COVID-19 or calling our COVID-19 info line at 562-570-4636. You can also follow at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you. And before I turn it over, I just want to add to Dr. Davis is just please note that there's an incredible partnership happening right now, and I wanted to make sure everyone knew that the City of Long Beach is in complete partnership with our sister city, Los Angeles, with the entire county of Los Angeles and the state and its leadership as well. There is an incredible amount of synergy. We're all working together. We're all supporting each other. And so to Governor Newsom and Mayor Garcetti and our partners at LA County, just thank you for the support. There has been a great partnership, and all this work is happening because of that close partnership in California. And so I do want to thank them. And I want to turn it over to Alice, who's going to, actually, I think we're going to take some questions first, and then from the press, and then we're going to turn it over to Alice.
Dr. Davis, there's a question here from the Long Beach Post with regard to how many COVID-19 patients in Long Beach have been hospitalized. Can you give us an explanation of that and go into that in a little bit more detail?
So in general, about 20% of patients who contract COVID-19 end up needing to be hospitalized. So that's our estimate, is what's going on in Long Beach as well.
A question from the Long Beach Press-Telegram. In the city's daily update, the chart showed the number of cases decreased Sunday and Monday compared to about a week-long trend of increase. Can someone contextualize that for me, and can that be attributed to the rate of infections slowing down, or does the true rate remain uncertain, given the limited testing capability?
So, okay, what's going on? So the testing, the lab results, there's a lag in reported cases. So what you're getting right now is a snapshot, but sometimes it can take 3 or 4 days for providers to report their positive tests or for it to come through. So we expect cases to increase. And so sometimes you will see little dips here and there, but it's not really a true decrease, we feel. It might just be kind of, some kind of data lag that's happening at that time.
Dr. Davis.
Let me add also, Doctor, we discussed this earlier with the health director. We don't think that while there were a lot of cases reported on that day that there was the large uptick, there's not enough data to know if that is any sort of actual trend. So it just could have been that day there were more tests were performed with our private labs. Because even though we are keeping track daily of the tests that happen at Long Beach Health Department, there is a little lag when we get the data from all of the private providers. And so it just could have been more tests were done that day, or there were more people that tested positive. So those are things we're looking at right now.
And also, a lot of providers don't report over the weekend, so you'll get this kind of big burst on Monday and Tuesday.
Dr. Davis, another question. Has anyone who is homeless tested positive yet?
As of today, no.
Another question relating to LA County Public Health. They're quite firm, saying that LA County area restaurants cannot operate as grocery stores because they lack the proper license. Can anyone on the panel elaborate on whether Long Beach will or will not be flexible, and in what ways?
So we are going to be aligned with LA County. We feel that this next 3 or 4 weeks is really crucial to blunt the virus, and so we are going to be in alignment with LA County to really try to have as many people at home as can be at home.
And one thing I'll add, because we've been discussing, a lot of restaurants are creating bodegas to try to make ends meet and to meet this need. And so one thing that we're discussing, because right now we do have bodegas operating across the city. One thing that we're discussing with the health department right now is there a way to do this in a way that is safe so that these restaurants can continue to make the revenue that they need while still aligning with kind of best practice health laws that LA County has put in place. And so that's something we're discussing over the next couple of days, and we'll have some hopefully more guidance from Dr. Davis and the health department as well.
Mayor Garcia, there's a question here about the status of community hospital. Will you elaborate, please?
Sure. Just that I think Governor Newsom mentioned community hospital earlier today at his press briefing. It is set to open any day. We want to make sure when it's open that it is ready and 100% functional, and that it's a full operation as it relates to a hospital. And so, obviously, the group, the group that's operating the hospital, I'm in constant contact with on a daily basis, and the governor's staff is as well. And so, the state has come in. All the beds are accounted for. When that hospital opens, it'll be a full functioning hospital that'll bring in transfers from Long Beach and our partners. And we're also looking at additional capacity for community hospital as well. And so this is a huge critical need. And the fact that we are reopening this city facility is really important. And so as soon as that hospital is ready, and really it's a question of making sure the hospital has all of the masks and the gowns and the equipment it needs to fully open. That is what we're ensuring right now, but we're very close, and so we are really days away, and we need it. The sooner the better.
Mayor Garcia, some of the questions from Facebook is relating to our first responders. Do they have enough personal protective equipment?
So our firefighters and our police department right now are using best practices that they are learning from other departments also across the country, and doing additional levels of screening and additional levels of protecting themselves and the public to ensure further spread within our first responders. We know that our police officers and our firefighters are already putting their lives on the line every single day, and so they are working with our health department and others to make sure that they have what they need to stay safe. And have put in different protocols as well. And so you might notice that when you're calling the police department or communicating with the police or the fire department, there's additional screening questions that might be asked. So please be patient with us, but it's for the protection of the public as well as our public safety officers. Okay, I think that's that. One more question?
Yeah, one more question, Mayor. Obviously, people are struggling, and they're very concerned about their financial situation. There's a question here, why can't we freeze rent?
And so I think right now the first step of the rent crisis was stopping the eviction piece. And so right now we are trying to work on implementing both the governor and the local action on stopping evictions. There is going to be further discussion from the Long Beach City Council, and they're bringing forward different ideas about how we ensure that there's additional support for renters, because we know that the $1,200 direct payment that's coming from Congress is just not going to be enough. That should be one. It should be more, and it certainly should be more than one time. At least I believe it should be. And so I believe the council is going to be having additional discussions around what the right approach is, because not only do we have to ensure that renters are able to pay the rent and not be evicted, we've got to make sure also that that people can afford their mortgages and that we don't have a complete collapse of the of that piece of the economy. And so I strongly believe the council will be looking at this and other issues in the days and weeks ahead. Okay, that concludes the questions. We're going to go ahead and turn this over to do a recap in Spanish. So vamos a hacer un parte de esto en español y muchas gracias.
Muy buenas tardes y gracias por estar con nosotros hoy otra vez. Queremos empezar con unas noticias más positivas. Una compañía que está basada aquí en Long Beach, Virgin Orbits, están en proceso de diseñar unas unidades de ventiladores que va a ser de mucho uso para nuestros equipos médicos y hospitales. Queremos recordarles de que están cerradas las playas, los senderos públicos, muelles, senderos para las bicicletas y puntos de acceso para la playa, canchas públicas, parques, tenis para los niños, parques y de patinaje y áreas de picnic también. Aclaramos que los gimnasios también están cerrados, también negocios que no son esenciales. También queremos limitar el contacto en las tiendas, pero las empresas esenciales deben hacer todo lo posible para garantizar el distanciamiento social entre sus empleados, lo que incluye permitir el trabajo remoto donde sea posible y separar físicamente a los empleados por al menos 6 pies. Todas estas pólizas estarán vigentes desde el día que empezaron, desde la semana pasada hasta el 1 de mayo o hasta nuevo aviso. También hemos tenido para facilitar el cumplimiento de Safer at Home o más seguro en casa en términos de congestión y estacionamiento. Los lotes adicionales para estacionarse es muy importante que limpiemos las calles. Por favor, si hay manera de mover su vehículo, por favor hágalo, porque hay otros lugares donde puedan acomodar a los barrenderos. Estamos recibiendo muchas preguntas sobre las pruebas de COVID-19 y nomás queremos recordarles que no hay suficiente exámenes en este momento. Estamos trabajando y con el Estado y el resto del país. Todos están viendo problemas en agarrar exámenes para el público, pero queremos acordarles que los exámenes que sí estamos haciendo en el Departamento de Salud es solo para personas de más riesgo y que tengan síntomas, que enseñen síntomas de la enfermedad por este momento. También queremos decirles que desde esta mañana han sido reportados 115 exámenes positivos en la ciudad de Long Beach, que ha sido un aumento de más de 50% desde el viernes pasado. En las próximas semanas, en las últimas semanas hemos visto grandes aumentos en casos en las ciudades grandes como Nueva York, Nueva Orleans y otros estados en el país. La diferencia de la gripe es que no existe una vacuna o medicamento contra el virus y como es nuevo, todos somos susceptibles. El virus COVID-19 está extendiéndose en nuestra comunidad en este momento. Entonces, queremos recordarles que entre menos personas tengamos cerca de 6 pies, es menos personas que se van a enfermar y menos personas que van a tener que visitar los hospitales y centros médicos. Así es que distanciarse físicamente es lo más importante. Y también, claro, sigan haciendo las 5 cosas para detener el coronavirus, es lavarse las manos, desinfectarse por 20 segundos, no tocarse la cara, cúbrase sus toses y los estornudos con su codo, distanciarse físicamente, pero también muévanse el movimiento esencial. Y si está enfermo, otra vez es recordarles que se queden en casa. Continuamos viendo un alcance nacional y mundial de sus suministros de pruebas para el COVID-19. Claro que quisiéramos evaluar a todas las personas en la ciudad, en Long Beach, que quieran hacerse la prueba, pero simplemente no hay suficiente exámenes disponibles para hacerlos y recursos en este momento. También, otra vez, solo lo importante es tomar ese espacio social, pero significa más que físicamente. Muchas gracias.
Y muchas gracias otra vez. And just as a reminder, every press release that we put out in English, but also in Spanish. We also put it out in Khmer and have Tagalog translation as well. And so those are all available at the COVID-19 website, all information that's all in different languages. So thanks again, and we'll see you on Wednesday.